Hello everyone, I'm Amira from Group 1. So today I'm going to talk about examination and noticing right side heart failure. So in the right side heart failure, the heart's right ventricle is too weak to pump enough blood to the lungs as blood builds up in the veins. Fluid gets pushed into the tissues in the body. The right side heart failure symptoms are included swelling and shortness of breath, and the treatment focuses on stopping progression of the disease and improving system. What is right side heart failure? So right side heart failure is a type of heart layer in which it is also called ventricular heart layer. And the right side of your heart pumps used blood from your body back to your lungs where it refuses with oxygen. And right-sided heart failure means your heart right ventricle is too weak to pump enough blood to the lungs. As a result, blood builds up in our veins, vessels, that carry blood from the body back to the heart. And this build-up increases pressure in your veins. The pressure then pushes full fluid out of your veins and onto other tissues, and then fluid builds up in our legs, abdomen, or other areas in our body, and it is causing swelling. So how common is right side heart failure? So each year more than 900,000 people receive a heart failure diagnosis, and heart failure is rare in people younger than 50. So with age it becomes increasingly. Common studies have shown that around 2 of the population younger than 54 years old have heart failure, and the number increases to around 8%, about 1 in 12 people over 75. So what causes right-sided heart failure? So most right-sided heart failure occurs because of the left side of heart failure, and this entirely heart gradually weakens, and in all it is often caused by heart blood pressure in the lungs, pulmonary embolism, lung disease such as chronic obstructive pulmonary disease. So what are the symptoms of right-side heart failure? So the main symptoms that we have to look out for, which we can indicate a right-sided heart failure, is the buildup of blood which leads to swelling or edema in our three ankles and lips, lower back, gastrointestinal tract, and liver, which cause acetate. And other signs also include recklessness, chest pain, and discomfort, as well as heart palpitation. So when we accumulate it, it depends on how much extra fluid in our position. So if we are standing, fluid typically builds up in our legs and feet, and if we are lying down, it builds up in our lower back. If we have a lot of excess fluid, it may build up in our belly, and fluid building in our liver or stomach may cause nausea, bloating, and appetite loss. So once right-sided heart failure becomes advanced, you can also lose weight and muscle mass. So these are also symptoms that we can look out for high right-sided heart failure. And how is right-sided heart failure diagnosed? So usually right-sided heart failure is diagnosed in our healthcare, where a patient will usually ask about their symptoms. So often this can be enough for practitioner to determine if it's a right-sided heart failure or not. And then we can also perform a physical exam where our provider or healthcare practitioner will take out pulse and blood pressure, as well as listen to our heart and lungs. They will also look for signs of swelling, and among the tests that are needed to diagnose a right-sided heart failure is chest X-ray, electrocardiogram, or ECG, echocardiogram, blood tests, especially to measure substances like meteoritic pipettes. And to confirm the diagnosis, we have to carry out MRI, CT scans, cardiac characterization, stress tests, and nuclear exercise tests. That is all from me today. So those are the ways to notice a right-sided heart failure. Thank you.